Hi everyone, I'm Dr. Michael L. Johnson. This is part 3 in our series. And we're going to talk about case fees because it's funny. There are certain groups out there that are actually selling against case fees. And I think, part of the reason is the guy was never successful doing case fees, nor were any of the people following him. And you know what? If you don't want to do case fees, you don't have to do case fees. I like case fees. I am a cash practitioner. There are a lot of HMOs in my area. I'm not on any HMO panels. The vast majority of people here in Appleton, Wisconsin are in HMOs. And if they want to use their HMO, I just send them down the street. See, I'm into getting people better. Nobody else can get better. And as a direct result of that, people pay me a professional income. I do year-long case fees because some of these chronic conditions that patients have had for 10, 15, 20 years, it's not going away in a month. It's not going away in 2 months. You may see some change with them at 3 months. And we'll get into this because there are chiropractors in our group who have 3-month case fees and they go 3 months, okay, your 3 months is up. We're going to do it another 3 months and this is what we're going to do, and they work up the patient that way. Some patients or some doctors work with their patients at 6-month case fee intervals. I like a year-long case fee. I want to get the patient better. I literally want to change their lives. And especially if a patient is an autoimmune condition, you are not going to treat them or cure them. You're going to have to manage that condition the rest of their lives. And how do I know that? Because I'm autoimmune and I have MS. So, whether you like case fees or don't like case fees, the reality is, folks, insurance is leaving. Yeah, I know there's some states, Illinois, Pennsylvania, still have great insurance. It's going away slowly. State Farm is going to an HMO model for those of you who are heavily into PIs. Many work comp insurance companies are moving into an HMO model. My God, California a couple years ago lost their work comp coverage in chiropractic. The reality is insurance is decreasing. It's going to continue to decrease until you're subservient and probably working in some hospital for $40,000 a year. And that's all well and good if you just want to hit the high spots. But if you literally want to make changes in people's lives, that they've been everywhere, done everything, nobody's helped them, and you're the person that helped them, our program is for you. Our message board is like nothing else out there. Nothing. We actually have an entire case fee and case fee alternative section. So, if you don't want to do case fees, that's great. Don't do it. They're not for everybody. If you want to do year-long like me, fine. If you want to do 6-month, great. If you want to do 3-month, fantastic. If you just want to charge a patient a monthly fee, fantastic. But none of this $99 and I'll see your whole family. That's insanity. Been down that road. Did the high volume. Not going back to it. Burned me out. Not fun at all. Okay? Or do a fee per visit, but make sure it's a professional fee. 10 or 20 bucks a visit with the copay, not there. So you're making a total of $30 a visit? Are you crazy? All the work and energy that you put into your schooling and your continuing education, and you're getting this patient better when 15 MDs drop the ball? Maybe they've seen a few chiropractors because you're addressing them neurologically and metabolically. You want to have a bigger practice? You want to have a more successful practice in 2012? Get better educated. Okay? That's what it's all about. Improve your clinical skills. Be a better doctor. That's what it's all about. There's no magic formula. There's no fairy dust that somebody sprinkles on you, and all of a sudden, you have this magical practice. Those of you who've been in practice as long as I have, or close to it, I've been in practice 29 years, maybe longer, maybe a little less, but you've seen this ebb and flow in chiropractic. In the 1980s, insurance, except for here in Wisconsin, was huge. You could pretty much bill anything and get paid for it. My God, doctors were billing, $500 visits and getting paid for it. The Mercedes 80s. And then things started to tighten up. And they've been slowly going downhill for the last 30 years. It's only going to get worse. So you have a choice. Either improve your clinical skills, or you're not going to be around 5 years from now or 10 years from now. If you don't think I'm serious, it's already happening. I talk to chiropractors, hundreds of chiropractors in the course of a month, both in and out of this program. And the doctors that I talk to who are out of the program, they're all struggling. I mean, some of them can't pay their rent, can't support their family. They've gone through a divorce or they're going through a divorce. It's not pretty. How do you combat that? You become a better clinician. You commit to be a better clinician than what you are now. You increase your level of intensity. You increase your focus. You increase your passion. So, you want to do case fees, great. You don't want to do case fees, fine. But we have a lot of options up on our message board that you can do. You can join our group, the Neuromuscular or Neurometabolic Supergroup, for as little as $144 a month. And we offer you a 6-month money-back guarantee. How many times have you gotten into some consulting group and 2 or 3 months into it, you know it's not for you, but you're locked in for a year or 2 or 3 years? I see it all the time. Or you're tied in with some franchise that literally is impossible to get out of. Franchises in chiropractic, I've just heard too many negative stories. That's why I never went the whole franchise route. Certainly could have. We have enough successful doctors. But my God, to pay $30,000 to $70,000 up front and then 7 to 10% of what you collect every month, it's insanity. So for as little as $144 a month, we offer you a 6-month money-back guarantee. Nobody else is doing that. You can come in our program, you don't like it at 3 months, you don't like it at 5 months, send it back. We'll give you your money back. I have had doctors, 2 or 3 dozen doctors, that we've done that with, they've joined the program a year or 2 later. I held up my end of the bargain, they were happy with that. Some of them even told me, I'm not ready for this yet, but I'm coming back. And they did in 6 months or a year. I just had one doctor do that at the Super Conference. You'll hear some of them if you go to lifechangingcare.com. Lifechangingcare.com shows you all of the doctors who are, or not all, but most of the doctors, level 2 and above, that are in our program. And their success stories, go to it. TX Chronic Pain, I have over 300 doctor testimonials. So, case fees or not, it's your decision. We're not, just because you join this program doesn't mean you have to do case fees. But make it a point to improve yourself in 2012. The Japanese have a saying, Kaizen, constant improvement, day by day by day by day. That's the change that you need to make. So I invite you to become one of our doctors. Again, as little as $144 a month, go to txchronicpain.com, go into the site, download the order form, download the free report. The free report will go over the different levels. And let's make 2012 a great year.